And welcome to Chamber Chat via Zoom. I'm Danielle McFadden, President of the Greater Lowell Chamber of Commerce. I'm so excited to have our friends here from the Lowell Community Health Center. I have Brent Carney, Director of Marketing and Communications, and Karen Pugh, the Senior Director of Integrated Case Management. How are you both?
Doing really
Great.
well.
Great.
Thanks for having us.
Yeah. Ditto.
Good to have you. And I was saying, Karen, before we got on, before we started recording, I love your background.
Thank you. I can thank Brent's team for that.
Very nice. Great
In
job.
full spring for Pride Month.
Yes, we had the unveiling of the Pride Walk right on Merrimack Street, and your CEO, Susan West Levine, was dancing down the walk with a lot of spirit, a lot of
Wonderful.
pep in her step.
She represents us well.
She sure does. So can you talk about the two biggest areas of concern you're seeing at the health center right now?
Well, I think two of the bigger ones really are it's still getting vaccinated. You know, our job right now is still focused a lot on getting people vaccinated. You know, we're doing well in the 5 to 11 category. Massachusetts is third in the nation, but we're still nowhere near where we need to be. We're about 60% of people fully vaccinated in the state, but that shows us that there's a long way to go still. And really, it's reaching out one person at a time and showing them that this is important. This is still, you know, your best way to protect yourself from severe disease. And you know, the health center still for patients every Wednesday and Friday hosts vaccine clinics. It's a walk-in, it's free. So if you're a patient here, we'd love to see you if you haven't been vaccinated or boosted. The other is deferred care. You know, we have so many patients, and this isn't unique to the Lowell Community Health Center. It's a systemic problem, you know, everywhere right now, where people have deferred just their regular care for you know, a year plus, maybe in some cases, or two throughout the pandemic. And it's really so important that those people come back and see their primary care providers, get a checkup, because if there's you know, disease or some sort of issue like hypertension that's been untreated or undetected and untreated for a length of time, that can cause so many more issues for that individual. So we want to get people back in the door, get them to see their providers on a regular basis to be checked up.
Thank you for bringing both those points up. I didn't realize that we still had such a ways to go in terms of vaccinations. So that's really important, I think, for the community to know about. And then also the deferred care piece of it. I mean, at this point, it's been like 2.5 years into the pandemic.
Yeah.
So it's really important to see your primary if you haven't been.
You know, our community health workers are out on the street. They're meeting with people, and they're talking to them about these issues one-on-one. So we're certainly working hard to try and do everything we can for both of those issues right now.
Can you both tell me a little bit about what your particular roles are at the Lowell Community Health Center?
So I am the Director of Marketing and Communications. So really what my focus is trying to educate the community and provide information to the community so that they can be healthier individuals. And so everything I do really focuses around that and supporting the experts. I'm an expert in nothing within the healthcare field. It's all the other people within this building. And, you know, I rely on them and want to get them out there so they can show everybody why what's happening here in this building is so important.
Karen.
And yeah, and I'm the Senior Director of Integrated Case Management. So I oversee grant-funded programs that sort of work on the population health side of things, focus on specific health issues. I manage some of those community health workers that Brent's talking about. We're reaching out into the community to try and get some of those marginalized populations that have been deferring care linked back to care and services.
Can you talk a little bit about what's available in terms of prevention and screening services?
Yeah, so one of my primary areas is our prevention and screening program, which is a program where individuals can obtain screening and linkage to care for and treatment for HIV, hepatitis C, and sexually transmitted infections. We also provide, we do the outreach that Brent discussed, and we also provide prevention and pre-exposure prophylaxis for HIV, which is a once a day medication that has been proven to greatly reduce the risk of transmitting HIV. And we do overdose education and Narcan distribution, as well as we partner with local community partners to do some syringe service programming.
Can you tell the community why these services are so important?
So first, I'd like to say it's so important for everybody to know their status, whether that's HIV, hepatitis C, just know where they stand in their healthcare. It's currently recommended from the CDC that everyone between the ages of 13 and 64 to be tested at least once in their lifetime for HIV. Those that have a higher risk factor, that are engaging in riskier behaviors, to be tested more regularly. So knowing your status gives somebody the power to make different decisions if they're able, and our care teams are able to provide them, with extended support to hopefully make some different decisions that are better for their health.
Does someone have to be a patient of the Lowell Community Health Center to access the services that we were just talking about?
So no, we're thankful through some funding through the Department of Public Health that folks can come to the health center and access services, whether they are patients of the health center. And if they want to become patients of the health center, our teams do that linkage to care. So sometimes we're able to find out if they don't have care, that we're able to link them to our providers, or we're able to help assist link them back to their existing provider. And so they don't have to be a patient in the health center, and they don't have to be insured to access our services.
That's great.
Yeah.
The Lowell Community Health Center is such an enormous resource for our community. I can't say that enough.
Mm-hmm.
And I don't think people realize that we do offer free services like this. These are hard issues for people and hard conversations amongst family, but there are resources here to help and to make a difference, either for somebody watching or somebody they know, and it's free and they can come in. A lot of our services, there are waits to be seen, and in this case, this is something you can come in and get the help you need.
Yeah, services are offered daily, and they're offered on a walk-in or appointment basis. So, we'll give everybody the telephone number and ways to access the services.
And I was just going to ask how somebody would access the services for themselves or a family member.
Yeah, so they can call. We have a direct dial line because we sometimes know it's difficult to call and get routed through a phone tree. So people can call 978-221-6767. And that telephone number is answered between the hours of 8:30 and 4:30 every single day, Monday through Friday. Messages can also be left and somebody can return your call, or they can walk in and ask for the pass department. We named it that so that people can get sort of expedited access, because we know some of these, there's a lot of barriers to testing for HIV, hepatitis C, and sexually transmitted infections. There's stigma. People are afraid of what their results might be, but we're here to offer hope and help people to understand that they can get services in a non-judgmental, low threshold way. So anything that we can do to help make it easier, just call that number, 978-221-6767, and our PASS team would be happy to help.
Thank you. And I just type that number down too, so that I'll include that when I post the video so that people can have the number right there.
Yeah.
And I was just going to add, I'm always impressed with Karen and her team as to how far they go to make sure that, somebody who needs the services that they offer, but has trouble talking about, has a number of different ways. They develop little cards that they hand out. So somebody could have one of those cards, walk in the door, and never have to say anything to anybody in public. They can just hand that card over and our staff will make sure they get to where they need to go to get this help. So, you know, and they're from bus ads to those cards, it's really something that they work hard to make sure that they're accessible. And you know, one thing too with the health center is that you don't have to speak English. We have medical translators available all the time. Most of our staff speak multiple languages, so you can get the care you want in your native language, which isn't something necessarily you can get other places.
Thank you for
Yeah,
mentioning.
we also have, we also have a very diverse staff that helps to for us to understand cultural barriers in care too. So we try and make sure that we take all of that into consideration when we're doing outreach or we're providing a direct level of service. So we want to understand how to reduce those barriers.
You're truly representative of the community.
Mm.
And another reason why you are such an asset for the community. Before we wrap up, could you just give like the, quick overview of the Community Health Center for people tuning in who don't exactly know what you do? So we talked about one aspect, but you do so much.
It's when I first started here, it took me a while because there is so much. We really are, much more than just the family doctor for somebody. We certainly provide those services. Pediatrics, family medicine, adult medicine, OBGYN, family planning. We have Karen services. We've got this amazing program called Teen Block for kids who can come in here and spend time together. And we just recently reopened that in person and have gotten some teens back in, which is really great. Yeah, we were really excited about that. Yeah. We have free services that help patients navigate insurance. And again, you don't have to be a patient to take advantage of that. If you need help finding insurance, getting insurance, we have people here who do that for free. And if you have children in the schools, we have 2 school-based health centers. So while it might be hard to get an appointment in adult medicine here, because we've got a wait list, if you've got a child in the high school, they can become a patient at the health center right there. And in the fall, we'll be offering eye care services at the high school as well. So, and obviously, tied in with that, we do have a full service eye care center. You don't need to be a patient. Come in and buy your glasses with us. There's a full shop. They turn it around real fast when you order something, and dental services as well. Karen, did I miss anything? I feel like it was a mouthful of a lot of stuff.
And I put you totally on the spot with that.
No. We also have medication assisted treatment for people who have substance use disorder, and we have behavioral health services for people looking for group or individual counseling and therapy and psychiatry.
Wow. You do it all. Like, what don't
That's
you do?
our goal. It's our goal is to
incredible.
wrap around with everything people need, that we can wrap around them and we can assist them with everything we need. We have several community partners in our building. We try and leverage our relationships throughout the community to make sure that we're accessible. And so, what like Brent mentioned, it's sometimes nice that we have some of these ancillary services that we can help sort of bridge the gap for some people while they're waiting to get that primary care appointment, that we can support them in other ways in helping with some of the social determinants of health.
While you can go from your appointment to Lowell General's lab and get some blood work done, then head down to CVS on our ground floor and get your prescription filled, we really do think hard about the fact that health is largely driven by things that happen outside of this building. So how can we have influence and impact on that? Whether, like Karen said, we're talking about housing and transportation, food security, all those things. Those impact why somebody's coming for services. so, it's an important thing about what we do, to make sure that we're helping people outside of this building as well as inside.
Incredible. Thank you both for all that you do for the community. It's quite remarkable, truly.
Thank you.
Thank you.
Thanks to all the people, all the nurses and providers, and from our IT team and finance. I mean, it takes a lot of people to make what happens here happen. And, our maintenance staff and, they've been tested, throughout this pandemic and been stretched to the limit. And it's just been remarkable to watch people who still come in here and love what they're doing every day.
So a lot of passion in that beautiful building of yours.
Definitely.
Well, thank you both so much. And I'm sure we'll have you on again sometime soon, Brent.
Look forward to it.
Awesome.
Thanks so much.
Have a good one.
Okay.
Bye.